Care Act opened the door for millions more Americans to get health insurance, despite GOP efforts to gut the program. Many states operating their own exchanges have seen a surge in enrollments. In many states, this week marks an end to open enrollment. Errol Pierre is a health economics professor and joins us. Professor Pierre, the enrollment period was extended in several states. It was also cut in others. What's the result been?
Sure. So in general, nationally, we've seen a surge. And I think what happened is during the summer, when the Republicans were looking to repeal and replace the Affordable Care Act, unintended consequences was it created awareness about the Affordable Care Act. So a lot of Americans saw it in the news and they were reading about it and started thinking about their own
Even though
coverage.
the advertising budgets were effectively slashed.
The advertising budgets were the government, federal budgets, but in the news, they were getting free press, just hearing about the back and forth. And I think, John McCain flying in to do that last vote, it created a lot of awareness outside of just what their federal budget was. So people were aware of it, and we've seen a surge in enrollments.
And so where do you think the numbers will end up compared to last year?
Sure. So, here's what's happening. Federally, the states shortened the time frame to December 15th, but there were actual states like California, New York, very blue, very progressive states that even extended it beyond that. New York's deadline is January 31st. So I think even with the bigger states opening the doors longer, we'll see probably more enrollment than we did the previous year.
So there are some challenges with the Affordable Care Act going forward, not least Republicans' continued efforts to repeal and replace, as they say. In some places, there virtually is only one insurer left in the market, and people are seeing increases in their premiums.
Absolutely.
How can first off, individuals deal with that, and second, how can states perhaps mitigate that?
Right. So right now, what I think Republicans and Democrats, so there's a gang of eight, that what they're trying to do is stabilize the Affordable Care Act. Even the popularity of it is up to like a 50% approval rating. So more Americans feel the benefits of that Affordable Care Act. So what they're trying to do is stabilize it, which means it needs an infusion of some cash. You have to fix the things that don't work and then keep the things that do work. There's a lot of provisions, like you can keep your child on the plan until age 26, no pre-existing conditions. People love that. And then there's other provisions which were removed that people didn't like. And I think it's more about working bipartisan to try to fix the things that aren't working, which would increase plans to jump into the Affordable Care Act.
So the Obama era fix to ensure that there were the pools were as varied as possible and that there was the healthiest possible mix of insured people in the pools was what was called the individual mandate, where if you didn't have the insurance, you had to pay a fine, and that you could basically take a choice between buying insurance or paying the fine. That's gone away now. What impact are we going to see going forward with the loss of the individual mandate?
Great question. So yes, in the tax law, they did remove the individual mandate. So theoretically, if an economist would say people who don't need it won't buy it, and so those are your healthiest folks. The people who do need it will buy it. Those are your sickest folks, most vulnerable folks.
And so it becomes more expensive.
Right. The average price goes up. So without that stabilization bill, where you can have sort of reinsurance, where you can sort of say, let's do high-risk pools, where we'll take the sickest out of the pool, we'll pay for them separately. Without a stabilizing bill, then the fear is this thing will unravel. But I think Republicans like Susan Collins and other Democrats are trying to work together to come up with a stabilization bill to save it.
So, historically, when you give people something, if you give them Social Security or you give them retirement benefits, it's almost impossible then to take it back because there is a perception that you're taking something away from me, something that was good for me. So we're now in a situation where there have been millions more Americans who have had health care insurance than ever before possible. Is there also a shift in the way people view health care?
Absolutely. So I think, we have about 9 million people or more who've enrolled thus far for January for 2018. We have over 20 million people that have got coverage through the Affordable Care Act. These are now voters, right? So they will say, I'm going to vote to keep what I have. I don't want to let it go. So the more people that that lost uninsurance and were able to buy insurance, they now don't want to lose it, and they'll vote to not lose it.
Even though in states like Kentucky, which saw the greatest growth in the number of insured under Obamacare, then turned around and voted for President Trump.
Correct. And I think that it has more to do about misinformation. So they're voting for Trump because they said he can improve it, he's going to make it better. That's what he ran on. I'm going to improve it, I'm going to make it better, I'm going to make it cheaper. You can buy across state lines. So they said, I like what I have, but that sounds better. And so they voted to have it better. And then after repeal and replace, when people found out I might lose it, you saw the reaction of people in Kentucky and other states that said, wait, this is not what I voted for, this is not what I signed up for. And I think that's why repeal and replace failed, and they weren't able to pass it back in 2017.
So we got a new health secretary today, Health and Human Services Secretary Alec Azhar, who is a pharmaceutical executive. He was sworn in today.
Yes.
What do you think his approach will be, and what kind of impact is he going to have on the Affordable Care Act?
Yeah. So as you say, pharmaceutical executive, he had prior experience in the Bush administration on healthcare. My thinking is he'll have an even approach. He'll have a business approach. He's obviously going to know lobbyists from his days in the past, but he's going to know, sort of how to sustain the markets, work with some of these for-profit companies that are in the markets and say, what do you need to stay in? If you have a state with one plan, how do you get more health plans to jump into that state? So I think, he'll definitely have a business capitalistic view of trying to fix the markets. But my approach would be he would want to at least increase the funding or increase sort of the population and the participation in the programs.
The left-wing Democrats like Bernie Sanders talk about the single-payer system. Do you see at any point in the next decade where there could be appetite and understanding for a single-payer system?
It would take a catastrophic, I think, change in healthcare. So, Medicaid has 1 in 4 Americans enrolled, so anyone who's low income gets Medicaid. Medicare, every 65-year-old, most of the 65-year-olds and above have Medicare, so they're sort of taken care of. It's that middle class bucket that sort of is hurt. Right now, the economy is good, people have jobs, you get your
a little extra money.
You get a little extra money, things are good. If you have another downturn like we did in 08, that's when healthcare became such a big deal, then absolutely. I think it will lead to people saying, hey, I need coverage, I'm not getting what I need, the middle class is paying too much, and you might see that swing to a single payer system. I think the apprehension to it is people think single payer means lack of choice.
Or rationing.
Or rationing. And we're in a capitalistic society. People love to choose their doctors. They don't want to feel confined to a certain doctor that they can't see. And so, it's an American value that's, I think, hard to get over. But I think if the climate is right and people feel like I'm losing what I used to have, I need something different, it could swing the other way.
Looking forward to the 2018 midterms, we know that healthcare is going to be a hot button issue for both the Democrats and the Republicans. How do you see that argument playing out for both parties?
Sure. So Democrats, independents, the number one thing will be healthcare. They don't want to lose it. Like I said, you have 9 million people that just got insurance through this new process. They're going to vote to keep their insurance card. I don't want to lose what I have. I don't want to lose my tax credits. I don't want to lose the coverage. On the Republican side, I think they're going to try to say, I promised we'll remove the individual mandate, we'll remove the requirement that you must buy insurance even if you don't want to. They were able to do that through the tax bill, so they'll say, we kept the promise. So don't forget that we didn't repeal the whole bill, but we were able to get that promise. Now you don't have to buy insurance if you don't want to. The Democrats are trying to increase your costs. This is a slippery slope to single payer. So I think that's going to be the debate. And I think, the more people who have insurance and it has a positive view, of the ACA, it's going to be more entrenched to not give it up. People don't want to lose what they have.
Errol, Pierre, thanks so much for joining us.
Thank you.
Thank you. Next, music's biggest night came with a healthy dose of politics.